for stability. Thank you.
Member for Lanark, Frontenac, Kingston.
Thank you, Madam Speaker. Madam Speaker, on February the 26th, the Standing Committee on Health passed a motion stating the following, that pursuant to Standing Order 1081A, the committee order all documents, including briefing notes, memos, and emails from senior officials prepared for the Minister of Health, Transportation, Public Safety, Foreign Affairs, and National Defence regarding the outbreak of coronavirus, no later than March 15, 2020. That matters of cabinet confidence and national security be excluded from their request, and that any redactions to protect the privacy of Canadian citizens and permanent residents whose names and personal information may be included in the documents, as well as public servants who have been providing assistance in this matter, be made by the Office of the Law Clerk and Parliamentary Counsel of the House of Commons. So the documents were provided, Madam Speaker, but they were redacted by the government in advance, and as a result, the Parliamentary Council has written complaining about this action. My question is, will the government reverse its course and allow the Parliamentary Council Law Clerk to do the redactions rather than redacting proactively?
The Honourable Minister of Health.
Thank you, Madam Speaker. And yes, during the course of the outbreak as it began, in fact, the HESA committee did compel over, well, it turned out to be well over 1,000 documents, and our officials also appeared in front of the committee a number of times, and I also appeared in front of the committee. We've spared no effort to try and ensure that the HESA committee has access to the professionals that it is compelling from the Government of Canada, as well as political leaders such as myself, as well as providing documentation, even as those officials were working day and night to try and ensure that our response was strong and robust to protect Canadians' lives. Thank you.
The Honourable Member for Lanark,
well, evidently they were not so busy, Madam Speaker, that they couldn't busy themselves with redacting documents, something that ought to be left. It was specifically in the committee's motion, a task to be left to Parliamentary Council. So I ask again, will the government submit the same documents unredacted so that Parliamentary Council can make those decisions as is appropriate under the privileges of the House?
The Honourable Minister of Health.
Mr. Speaker, we will always comply with the Health Committee's requests for appearances of officials, appearances of ministers, and of documentation that is required for them to complete their studies.
The Honourable Member for Lanark, Frontenac, Kingston.
Part of that request was that all such redactions, quote, be made by the Office of the Law Clerk and Parliamentary Counsel of the House of Commons. Will the Minister and her government respond and respect that request?
The Honourable Minister of Health.
Madam Speaker, since the beginning of the outbreak, in fact, we have appeared in front of HESA, my department, and me numerous times to answer questions to their fullest, to provide technical briefings to the committee to ensure that they have the information they need to study Canada's response and Canada's next steps. We continue to provide documentation that is requested. We completely value the work of HESA in examining the response of Canada, but also in looking for the next steps ahead.
Honourable Member for Lanark, Frontenac, Kingston.
One gets the impression the answer to that is no. Well, the Minister is certainly reluctant to say so. Madam Speaker, it's worth noting that in the special order that was adopted by the House on April 11th, the Health Committee is set up to proceed, but only to receive evidence. It is not permitted to pass motions. If it could do so, it would, of course, pass a motion demanding that these documents be submitted to the right, and perhaps chastising the Minister for her actions. I want to ask why that is that the ability of this committee to pass motions and to make reports has been taken away from it.
The Honourable Leader du Gouvernement.
The Honourable House Leader.
The Health Committee has met, I think, 5 times. Finance Committee has met around 5 or 6 times. Also, other committees are meeting, Madam Speaker. And I know the people in the House are working really hard. The people on the committees are working really hard. And we have to make ways find ways to make those committees work. And they're working, actually, Madam Speaker. So the members of the committee can ask questions, invite people, and get the answers. And that's what they're doing, Madam Speaker.
Member for Larnac, Frontenac, Kingston.
The Health Committee and also all the other committees, including the Indigenous Affairs Committee set up today, do not have the ability to make reports. They do not have the ability to pass motions. And there is no reason in the world why they should not be able to do so. I note that on the April 11th motion, the Procedure and Affairs Committee was specifically mandated to adopt motions and reports. Why is this being withheld from the Health Committee and from the other committees that are sitting right now? Thank you, Madam Speaker.
The Honourable House Leader, Government House Leader, very short answer.
Speaker, the committees are working on the basis of what has been approved by all parties in different motions, and everybody's working extremely hard to be able to answer the questions of parliamentarians, and that's what the committees are doing now.
Le député